Today we're going to be talking about a common digestive condition that's going to be found in cats. It's called intussusception. Intussusception is also known as telescope bowel. As you can see in these images, that's what your intestines should look like versus a telescoped one where it begins to fold in on itself. So we can see that like right here in the intestine, it should just go straight down. However, this part right here has then folded in on itself and has gone into the third layer right here, this segment of the intestine. Intissus, which is technically not a real term, however, it could be just inferred that it means the intestines. Same with seption, which is indicating a layering or nesting. Think of the movie Inception, where they're going deeper and deeper into themselves. It is technically a gastrointestinal obstruction. So this is when the segments of the intestines become enveloped with one another. These are going to be either, as seen in this one, where it is moving forward on itself, which is going to be a antegrade, or if it was doing it the opposite way, it would be a retrograde envelopment. It does affect the intestines in strange ways. These are some of the symptoms. Here's also a better image that is a bit more understandable when looking at it with the two different segments telescoping inside of one another. These are going to start creating different types of symptoms that are going to be noticeable in your pet. So depression is going to be the first one. Is your cat going to start having stranger, lesser emotions? Are they going to act more lethargic? Are they going to add all these, more noticeable characteristics in their personality that wasn't there before? Acute vomiting. They're not going to be puking up everything that they've ever eaten, but they are going to start showing some intestinal and digestive issues, so acute vomiting and abdominal discomfort. Additionally, they are going to have bloody stool. That is going to be a big indicator that something is going on, especially in their gastrointestinal tract. Additionally, anorexia, so they're going to just stop eating. It's going to hurt them to eat. They're going to keep puking stuff up, so they're going to avoid eating in general. The causes for this are going to be obstructions of a foreign object inside their intestines. So mainly with dogs are going to be eating pretty much anything in their body. This can mess up their intestines. For cats, they are a bit more noticeable what they eat. The biggest thing that is seen are linear objects, so things like string, yarn, things on their toys, feathers. So these are going to be linear things that are going to get stuck inside their intestines. Additionally, parasites do cause this as an issue as well. These are going to be worms of parasites, and these are going to be intestinal worms. Pancreatitis, which is going to be the inflammation of the pancreas. If the pancreas starts inflaming, there's going to start being other issues in the body. This is going to be one where the intestines are going to telescope on themselves. And if they have had recent surgery, that can cause this to happen as well. So we're going to be looking at a test that could be done. This is going to be the complete blood count, or the CBC test. This test is going to count the white blood cells, the red blood cells, as well as platelets. This is going to tell if there are any abnormalities going on in the cat, especially in their blood. So if you see bloody stool, you should go check what's going on. Why are they losing it? What's going, like, how is that affecting their body? This is not a sure way of finding out, they're having some issues in their intestines. However, it is going to be like there are some problems going on. You could also tell if that the cat is anemic or not. Additionally, there are imaging tests. So these are going to be our x-rays. X-rays are going to be the radioactive imaging of the body. This is going to usually be done in a ventrodorsal imaging. So preview right here on the right of a dog ventrodorsal image. Couldn't find one of a cat, sadly, but it's going to be relatively the same image, and it's going to be done from stomach into them, and that's going to be so we could see if there are any tumors or foreign objects that are going to be starting these issues. Additionally, there are ultrasounds, which are done very similarly, however without x-ray. They're using imaging of sound waves. This is going to be also finding the exact same thing. Both of these, however, or x-rays are going to find more on the focus on tumors or foreign objects, while ultrasounds can also help find for parasites. This image right here shows that ventrodorsal imaging, and this is a object of corn that got stuck inside of a dog's intestinal tract. Treatments. So there are very minimal treatments for this. There's not a lot of medication that you could do to just reverse how your organs or reverse how the cat's organs are internally failing, especially, you know, the intestine. So surgery is going to be the most common practice. This is going to be two separate surgeries that could happen. There could be a manual reduction. This is where the surgeon will unfold the segments and pretty much straighten out the intestines a little. This has a really high chance of reverting on itself, which means your cat might need another surgery. So there is also the full removal of the affected segments where they are cut and reattached to themselves. This is known as intestinal anastomosis. And then after those treatments, of course, your cat is going to need some analgesics. Sorry. Analgesics, sorry. Additionally, antibiotics. So the antibiotics are going to be, of course, to fight for bacterial infections and prevent that. IV fluids, so that's going to be fluids that are going to be put directly into the veins. This is going to be saline, vitamins, electrolytes, things to keep the cat going. Forgot to additionally on this, the treatments are going to be in a hospital, and then after that there are going to be more prescribed medication that are going to be a bit longer, such as antibiotics, and there's going to be routine checkups after that. Here are my references.